Hi everyone, good afternoon. We are from Group 2 and this is our quality issue for today. We will discuss about patient waiting time in Hospital Sampurna, outpatient or visiting specialist clinic. Okay, next. Okay, this is a little bit about institution background of choice from us. We choose Hospital Sampurna. This hospital was established since 1970 and it located in a district called Sampurna. It's type 4 non-specialist hospital, which having 260 staff, consists of professionals and support. We have 13 medical officers and 76 registered nurses. Okay, next. As we can see over here, Hospital Sampurna located far from Hospital Tawau. Hospital Tawau is as a lead hospital for Tawau cluster. You can see the lead hospital or the tertiary hospital, distance is 110 kilometers from Hospital Sampurna. Next. A little bit about vision, mission, and objective. Our vision in Hospital Sampurna is to provide excellent health services towards a healthy and prosperous society. Our mission, always strive to improve service quality through teamwork that practice corporate culture, serve facilities, and community involvement. Our objective is to provide friendly, efficient, fair, and effective medical services, as well as improving the level of quality so that customers can enjoy lasting health. Next. Right. As you can see over here, this is a list. This is a list of hospital services that offered in Hospital Sampurna. We have clinical services and we have ancillary department. Clinical services, we have inpatient, 24 hours emergency and trauma, surgical unit, which consists only minor surgery, obstetric and gynecology, visiting specialists, especially medical, surgical, orthopedic, pediatrics, ONG, and psychiatric, hemodialysis, and rehabilitation unit. While ancillary department, you can see over here, we have lab, blood bank, radiology, pharmacy, dietetics, medical record, finance unit, maintenance and forensics, and also ambulance services. Next. All right. A little bit about the organization, especially in specialist or outpatient clinic in Hospital Sampurna. Led by the hospital director itself, they have one unit coordinator, which consists of medical officer that will coordinate the unit with the help of chief medical assistant. And as you can see, we have only 5 staff that doing the job in Hospital Sampurna Specialist Clinic or Outpatient Clinic. Next.
Good evening, dear colleagues and professor. So I'm going to talk about a bit about the external and the internal mapping for the hospital from different type of category of the issues, the pros and cons. So from the economic side of view, so a general environment wise, it is a tourist attraction from all around the world. It is a good place for diving spot, and that is its main economy is fishing and tourism. From the health sector wise, it provides a affordable healthcare, and then it serves as a major referral for the nearby health center. Service wise, it is a preferred center for most indigenous and immigrants also as well, besides Malaysians. From the social and demographic category, so general environment, it has a high number of indigenous and also immigrants, forming a multicultural society. From the health system wise, the percentage of the local and the immigrants are more or less the same with the health-seeking behavior. And then service wise, it is shared of their facilities among the local and the immigrants as well. Legislatively, it provides a stable political environment, and then the health system sector, there's no rejection of policies set by the government. that causes bad implication. Service-wise, it has it has less concern by higher political leaders, especially by the opposition party area. Technological wise, from the general environment, it is not aligned with the demands. In the health sector, there is no advanced technology provided by the private institutions. There is no MRI or CT scans available throughout the area. The service area wise, it receives supports totally from the government, even for the funding for the new technology. Competition-wise, there are no other private hospitals around, and then there are only 12 GP clinics around the city, which provides basic care and treatment. It serves as a main referral center for most urgent cases. Next, I'm going to talk about those internal uh, pros and cons. So pre-service wise, from the service delivery side, we can see the strength is that it serves as a main referral center with easy access, and then it's located at the city center and the main road. Otherwise, the weakness is that it has a limited number of bed and facilities. Point of service wise is a 24-hour, 27 service with no rejection policy, no closed door policy. Otherwise, it is a non-resident specialist hospital. So the hospital, they only come on a weekly stay on rotation from tertiary hospitals. And then defects vital facility, but it has a complete major OT and radiology. After service wise, the strength is that the community follow out with multi-agency collaboration is seen. Other, Otherwise, however, the negative customer trust and perception on the service capacity because it serves as a public hospital. Support activities wise, from the cultural aspect, the strength is that it's the hospital is made of multicultural and motivated staffs. However, immigrants occupy more beds for treatment compared to the locals, and then there is a high defaulting rate in a lot of discharge against medical advice cases. Structure-wise, the good thing is that almost all the specialties are provided, but with some limitations. The weakness is also the limitation for the service facility expansion and also the bed additions. Strategic resources wise, the good thing is that there is in-house visiting specialists, and then with a multi-skills trained medical officer with a clear directional vision and mission. However, there is a high account of receivable and long-term debt which affects development and funding. Thank you.
Okay, I will proceed with our study setting, which is the outpatient clinics. Next. Okay, as you all can see, here is our graph and also our data on outpatient clinic attendance from 2022 up until 2024 for the trend of the last 3 years. You can see from the new patient and also on the follow-up patients. The follow-up patients with having increasing in trend of the in term of the numbers from 3,765 to 6,022 patients on the follow-up. So it double the number of for the last 3 years. In terms of the new patients, it's kind of a bit of low, but it's not balanced between the follow-up and also the new patients. Okay, next. Okay, so what happened with the increasing of the numbers in our outpatient clinics? So we have increasing complaints on waiting time during clinic day. So that's our main focus issue on the quality aspect. So most of the complaints are regarding patient consultation waiting time, which is the optimum that we are setting is 120 minutes. But the average that we can achieve right now is 180 minutes. So after some of the discussion and also some of the revision done, these are the main contributing factors, which is one is short clinic time and also visiting team comes late and depart early. usually from 9 a.m. up until 1 p.m. So second thing is only one specialist available and attending for the increasing amount of the patient and also per sessions. Third is low discharge but high new cases. Fourth is very deficient facilities, for example, like waiting area, toilet, and calling system. And the last one is deficient supporting staff and also increase in doctor-patient ratio, which is 1/30. So the all contributing factors will be better illustrated in our problem 3. Next. Okay, so our problem statement would be the increasing patients' complaint on waiting time during clinic day in Hospital Sempurna is a non-resolving issue until now. So even worse, the number of complaints keep increasing by years concurrently with the number of patient visits to the clinic. So it has negatively impact patient satisfaction and also the quality of service delivery. Okay, continue with problem 3.
Next, please. Thank you, Dr. Hariri. So we have come to the final part of the presentation today, which is the problem 3. Our main issue is the longer patient consultation waiting time. So let's just go into the root causes of it. Next, please. So for this issue, we have identified 3 major causes. The first one to begin, which is human resource limitations. As my colleague mentioned earlier, there is only one visiting specialist who comes from the tertiary center to Hospital Sempurna, and that to cater for the whole hospital, which is 1 to 30 patient ratio, which is not enough. Obviously, it's not enough, and there is no in-house or resident specialist available. As we move on to the second causes, which is high turnover and resignation staffs. Obviously, this is because of the pre-existing staffs are being exhausted due to workload as well as brain drain and fatigue. Moving on to the second major cause, which is the system and operational inefficiency itself within Hospital Sempurna. We have identified a couple of miscommunication and inefficient workflow within the outpatient department itself in dealing with this consultation waiting time. As for the main thing to be highlighted is the short clinic time, which is 9 a.m. to 1 p.m. only. As the visiting team, as mentioned earlier, they come late and they leave early, regardless of number of cases being registered, the number of new cases as well as the follow-up cases. Moving on to the third cause, which is the infrastructure and facility constraints. There are limited numbers of consultation rooms available. There are also lack of proper computerized calling system to ease the inefficiency during the outpatient clinic times. So furthermore, to add on to these constraints, the main issue is the lack of financial support from our Ministry of Health itself. Okay, so what would be the effects of this issue if it's just left to be prolonged? We are already facing impacts on our patients, staffs, and also our healthcare system. To begin, the effects on patients. Patients are being rushingly reviewed, not properly followed up during our outpatient clinic because, from 9 a.m. to 1 p.m., we have to finish the patient load. So moving on to the second, there are lack of health information being delivered by the doctor to the patient itself. All this would lead to reduced patient satisfaction and poor patient outcome itself. And the second one is impacts on our staff, which our staffs, due to the workload, they have been experiencing a decline in their physical and mental health. And absenteeism is being increased. And obviously, the staff satisfaction has reduced much with the service. And lastly is impacts on our healthcare system itself, the increased burden on healthcare, leading to higher morbidity as well as mortality. And this has created a bad reputation and loss of public trust, especially when it's a government hospital, which could not cater this issue. So as for now, this is what we have analyzed under our problem 3 for our issue. Thank you.